Welcome, everyone, and thanks for tuning in. I'm Sol, a PhD candidate working in the Exercise Physiology and Cardiovascular Health Lab at the University of Ottawa Heart Institute. I'll be your host for this episode of BEaTS Research Radio, a YouTube channel and podcast which aims to disseminate science to the community. We are delighted to have with us Leonard Benoit. Leonard works as the Indigenous Patient Navigator for the Toronto Central Regional Cancer Program. He is a nurse who knows well the ins and outs of the complex health system, thanks to his community service work over the years. Welcome, Leonard.
Thank you, Pisqual. Welcome. I'm really excited to be here and have a chat about who I am and what I do as a navigator and some of the Indigenous concerns that as it relates to healthcare.
Thank you. Yeah, we're very thankful that you're sharing your time with us and excited to learn about your work and especially about what we need to change to make our healthcare system more culturally representative and accessible for Indigenous people in Canada. Let's get started first with what does an Indigenous Patient Navigator do and why is this job necessary?
That is two really good questions. So what does an Indigenous Patient Navigator do? I work within the cancer care program, so I help access and coordinate services for First Nations, Inuit, Métis people and their families that have a diagnosis of cancer. Now that can mean it's very individual care. It's no blanket coverage. So I help, put out fires. I light fires. I make sure that folks, when they come into healthcare, are treated fairly and with dignity that honors the path of well-being with Indigenous people. Sometimes that is going to appointments. I sit in hallways a lot with folks. I bring emotional support. Just navigating with things around transportation or insurance purposes, getting them connected to social work, making sure that they have the best possible outcomes. Appointments are sometimes I remind folks of appointments. I will chase down doctors in hallways to say, this is what's going on with this patient. Can you help me understand that so I can relay it to the patient? For the healthcare team, I can bring the individual's perspective to them. A lot of healthcare providers don't know the history of First Nations, Inuit, Métis people. So for me, it's a lot of educating. It's behind the scenes saying, this person is a residential school survivor. So maybe this is why when they come into care, their behavior is like this. Or maybe we need to take a different approach because of whatever happened. I refer to it as when we show up, we bring our invisible luggage with us. That's our intergenerational trauma, our past experiences. Data shows that 80% of Indigenous people, before they even come into care, 80%, and that's a lot, they sit outside and think, how am I going to deal with racism that I'm going to encounter at this interaction? Why is this job necessary? For First Nations, Inuit, Métis people, the rate of cancer is disproportionately higher than non-Indigenous population. Indigenous people tend to, by the time they get diagnosed and get connected to care, they have a higher rate of, or they become, their rate, which could have been curative, is now no longer curative. So now they progress to what we call palliative. And that can be for a caliber of reasons. It can be because of past experiences, not having good diagnostics, living away from one of the bigger centers, right? In some languages, some Indigenous languages, cancer does not compute. There's no translation for it, right? So there's those things. Also, with my job is to make sure that when Indigenous people come into healthcare, they are done so, or they are treated in a culturally responsive manner. We all talk about, cultural awareness, cultural competency. I like to call it what it is. It's anti-racism is what it is, and making sure that folks are treated with dignity and respect. People are, when you hear the words cancer, the first thought is, oh my God, I'm going to die. if you air anything, you probably only air after the conversation anyways. So for me, I can be that other set of ears that say, okay, this is what the doc said. Do you understand what that means? Do you want to go back and go over that again? And of course, given our history, First Nations, Inuit, Métis people don't really have a big trust of the medical system. I mean, when you think of, Indian residential schools, right? Indian hospitals, right? The things that have happened to our community and those, we don't have a good history when it comes to who we are as people with healthcare. I mean, the other part is the healthcare was designed and built for anybody but us. So it had to be adapted to us. And anything you adapt, you generally don't get the same kind of usage or accuracy as you normally would. So, yeah.
Yeah, the system is built more for the predominantly Caucasian population and not for ethnic minorities or indigenous people. So I think your role is really, really important. And you talk mainly about cancer because that's your focus, but we know that in cardiovascular disease care, like if an indigenous woman is diagnosed with heart disease, her risk of death is higher than if a Caucasian woman is diagnosed with heart disease. So this applies to many other fields.
Absolutely. I mean, even though my portfolio is oncology, I have been told by my director and the powers that be that any Indigenous person in hospital, if their care team or they reach out to me, then I respond, because in our world we leave no one behind. Like we don't leave our brothers and our sisters behind. Everybody is family, everybody is community. So that request means that I will still be a part of that care, whatever that looks like.
Nice. Thank you for that really comprehensive explanation. We'll move to the next question that it's more about what are the most urgent gaps that we need to address to create a more culturally safe experience for Indigenous people. Part of your work consists of educating healthcare professionals, as you said, about Indigenous history and culture. Is that enough, or are there a few other things that we need to work on?
That is an amazing question, absolutely. And you and I can talk all day about this one, but I know we don't have all that time. So the most urgent gaps that we need to address to create a more culturally safe experience is we need, and I mentioned it earlier, we need to talk about racism. We need to talk about how rampant it is. We've all heard of examples in the news recently, both in the city of Toronto, across the country and whatnot. Like when we think of people like Brian St. Clair, Joyce Iskasheen, and those are the people that we are aware of, it happens more than it should happen. We need to be able to make sure that when Indigenous people come into care for clinics, treatment, any kind of whatever that deals with their health needs, is that they feel safe. And they are the only ones that can say that it's from a trauma-informed care, because the person has got to feel safe. All of those institutions say, and they do say it quite well, that they practice from a trauma-informed care. They can say that, but the patient has got to feel it. And until that's transferable, we got lots of work to do. So racism is one thing. Looking at, when I walk into spaces, is there any reflection of who I am as an Indigenous person? Like, is there a wellness space created for me? Chances are there is not. Most hospitals have found room for coffee shops as opposed to finding a place for Indigenous people to do their ceremonies, right? Of course, that's the other part, is making sure that Indigenous people can do ceremonies in hospital. I mean, there's legislation such as the Smoke Free Ontario Act, which clearly states that we can. There's the Human Rights Code. Some hospitals have created policies to that effect. I know my program, the Toronto Cancer Program, have created a document called Wise Practices, which outlines the need for ceremonies in hospitals. The other part is signage. Where's the signage that says, when I come in through this door, this is recognized as being on traditional territory, right? Who are the staff that's working with me? Like when you look at the Truth and Reconciliation Calls to Action, it clearly defines or says in those requests that we need to have more Indigenous people in healthcare. They need to be hired in healthcare. They need to be more present, and we call upon senior management to do those kind of things. So that's some of the big gaps that I see. Right. Of course, adding more navigators, because I am one navigator. I am one of 10 across the province of Ontario. So we've got large areas to cover. More navigators in different areas, such as cardiovascular, such as diabetes, such as mom and baby. Those are the kind of things. We know what the gaps are, but until we actually start putting those into action, those gaps are just going to stay there. They just remain gaps, right? So we need to start making things that, as we move forward, we actually put things into action. We come up with a plan, very robust, and we say, now, how do we do this?
Thank you so much for those main focus area. And I agree as well that if the healthcare workforce was a bit more representative, it's quite rare to see Indigenous physicians or nurses. So if we invest a bit more on making education a bit more accessible for people from ethnic minorities, they might later on understand better these patients.
I do believe there are more of us in healthcare than disclose who we are, right? Because it's a place that if it's not safe, we're not going to say, I am an Indigenous person, I'm an Indigenous woman, I'm Métis, I'm First Nations, I'm Inuit, right? We're not going to do those things. I have worked with most of my coworkers, right? I've been nursing for 20-something years, and I never disclosed because it was never a place that I felt that I could be safe. And until I started doing this work and working in community and getting connected, that's when I started feeling safer. And then I could say, hey, listen, I am an Indigenous man and this is who I am, right? So it's got to be that safety component. Right?
Yeah, great point. Thank you so much for joining us today. This is all the time that we have today, so this will conclude our episode. But thank you for letting us learn a bit more about how we can adapt the health system to the Indigenous community. And thank you. We wish you all the best on your important role. We thank the listeners as well for checking this episode, and feel free to subscribe to our YouTube channel or find us on your favorite podcast app. On behalf of the whole team here at BEaTS Research Radio, stay safe and healthy.